Here is the 3D anatomy of the corticospinal tract. Now I am not going to explain all the individual levels here because we have done that in a different video. But just for an overview, here is the cerebral cortex, and this shows the somatotopy of the corticospinal tract. The head fibers come from the lateral aspect, the arms here, trunk here, and the medial side of the cortex gives off the leg fibers. We are talking about the precentral gyrus, which is in other words called the motor gyrus or the motor cortex. In a transverse section, the cortex looks like this. You can see the internal capsule is here through which all the fibers are going to pass through. Now remember, in the brainstem, the corticospinal tract occupies the anterior part of the brainstem. In the midbrain, it is here. In the pons, it's here. In the medulla oblongata, again it's here in the anterior aspect. In the lower part of the medulla oblongata, the corticospinal tract is still in the anterior part, but from here he starts to cross. He decussates to the opposite side. So you are seeing the X mark here. Because the majority of the fibers have decussated, in the spinal cord at any given level, the so-called lateral corticospinal tract, which is already decussated, is always on the lateral side, whereas the anterior corticospinal tract or the uncrossed fibers are in the anterior side, same as the brainstem. They maintain the same place. Now in this model, we can see how the corticospinal tract arises from the top and runs all the way down. You can see from here, the fibers arise from different parts of the cortex. They go into the internal capsule, traverse through the brainstem, and finally to the spinal cord. These fibers, shown in blue, are the upper motor neuron fibers, which go all the way down to the spinal cord. Remember, only in the pons, because of the presence of the middle cerebral or peduncle, the arrangement of the fibers are shattered, whereas at the top and bottom, they are more like a bundle. Okay, that's the upper motor neuron. They go and end in the anterior horn of the spinal cord at all the levels. That anterior horn gives off the anterior horn cells and the lower motor neuron fibers, which go and innervate the respective muscles. Now, because the model is too tall, it's a bit difficult for me to show an individual detail, zoom inside, and compare that with the brainstem or the spinal cord details. So I have isolated the details from the brainstem and from the spinal cord so that I can discuss those details only with a closer look. We have already seen the details of the corticospinal tract, so I'll recap using a smaller model which shows only the essential details of the corticospinal tract. At the lower level of medulla oblongata, the corticospinal tracts start to decussate. So it crosses from one side to the other side. You can see that on both sides. The crossed fibers form the lateral corticospinal tract, as we saw in the spinal cord, and they terminate in the anterior horn cells to supply the limbs, for example. The fibers coming down are the upper motor neurons, whereas the fibers leaving the spinal cord are the lower motor neurons. Some fibers descend down the spinal cord without decussating. You can see that they are not decussating in the medulla. Instead, they come directly to the spinal cord. But what happens in the spinal cord? They form the anterior corticospinal tract, and when they terminate at a given level, they terminate on both sides, bilateral innervation. That means if you cut this tract accidentally, the part of the body will not be affected because you are also getting a connection from the opposite side of the tract. That's why if you see a patient with a paralysis, the structures supplied by the lateral corticospinal tract like the limbs are highly affected, whereas the trunk or the midline parts of the body, which is having bilateral innervation, are not affected. In the spinal cord gray matter, in the anterior horn, you can see that there is a medial motor column, which means there is a collection of nuclei giving off the neurons that supply the trunk. And those are the ones supplied by your uncrossed anterior corticospinal tract. And that's what we are talking about. It has bilateral innervation. Because it is on the medial side, it's easy for that tract to terminate on the medial side and thereby supply the medial motor column. Whereas the lateral corticospinal tract gives off the fibers supplying the lateral motor column, which will go to the limbs.